Chittranjan Dubey, who's an environmentalist, and he joins us now from New Delhi. Good to have you on the show. Explain, how do you get more than 1 billion people to observe this curfew when we're seeing countries in Europe? We saw President Macron in France, for example, can't even get France with 70,000 people to observe the measures to stay at home.
Yeah, so today is the first day when we are going to have this 14 hours curfew, nationwide curfew. And as you mentioned, like, it's a country where the population is 1.35 billion. But so far, luckily, people have appreciated this step taken by the government of India. And people are like sitting at home, and we don't see like anyone on the streets of India. And I will say that so far it's going good. And I hope that people will keep maintaining self-control, not only today, also in coming days.
And what are the particular challenges that India will face?
Oh, there are many challenges we could face if it goes out of hand. So as we speak, we have 322 confirmed cases and 5 deaths. But these numbers are very conservative because I don't think government of India has done enough tests so far because of lack of resources, of course. So if we see a crisis like which happened in Italy, it's going to be horrible for our country because we are 3 times more densely populated than China. We have hundreds of millions of people who are below the poverty line. Millions of people are sleeping on the streets, and they don't have proper facilities to safeguard themselves. So, of course, we are going to face many challenges, no matter it's about health, well-being, economy, or social collapse. So, unless we take some drastic measures, otherwise we are going to suffer a lot, unfortunately.
Unfortunately, indeed. And how are the hospital systems across India? I know it's such a huge country, but give us an idea.
So mostly majority of people go to the government hospitals, and they're already overstretched because of this pandemic. Then we have private hospitals, but private hospitals are out of hand, for majority of people. Those, especially for daily wage workers, they can't go to private hospitals. But I will say that the government officials are trying their best. The government doctors are working overnight, and they are doing whatever they could do. So I will say we wish that it shouldn't go out of hand. We shouldn't enter the stage 3. Otherwise, of course, we are going to suffer because we don't have the proper medical facilities comparing to developed nations. Even comparing to our neighboring countries like South Korea or China, I think we are quite behind.
Chittranjan Dubey, thank you so much for the update from New Delhi.